Hi, my name is Sahil Sandhu, and I recently graduated from Duke class of 2020. I'm really excited to share my experience working with the Duke-Margolis Center for Health Policy. At Duke, I designed my own degree through Program 2 called Health Innovation Evidence to Impact. So in my degree, I studied how do you assess health and healthcare needs and design, implement, and evaluate new healthcare innovations. I first became interested in health policy when I took a class on the US healthcare system through the Stanford School my sophomore year. I was really interested in learning how the US could spend more money on healthcare than any other high-income country, but still have worse health outcomes. So this led me to apply to become a summer intern at the Duke-Margolis Center in the DC office. And I was really fortunate to work with the global health team there to study how we could learn from health innovations in financing and care delivery from all over the world and bring them to the US and adapt them here locally. And in the internship, I really learned that improving healthcare meant creating new ways to pay for healthcare, focusing on community health, developing new ways to engage patients, create infrastructure for data analytics, and improving care coordination. But I really got most excited by innovations to integrate healthcare with social care. So we know that social and environmental factors like food insecurity and housing stability are major drivers of health outcomes. So my junior year, I had the opportunity to lead a Basque Connections team affiliated with the Margolis Center, working with a local community health center to implement a program to help Durham patients connect to community resources for their social needs. And we hope that our work can align with North Carolina's broader work in transforming Medicaid to better address the social drivers of health. And this summer in 2020, at Margolis, I've been able to think about healthcare and social care integration at a larger scale. So I've been working with Dr. Charlene Wong at Margolis on a new Medicaid model called the Integrated Care for Kids. And this model will cover 5 counties in North Carolina, and it aims to break down the silos between 10 different health and social services, from schools to child welfare to juvenile justice to behavioral health. And through that experience, I have had the opportunity to talk to subject matter experts from all these different domains within North Carolina and deepen my understanding what it means to implement a new policy model. I'm so grateful for the Margolis Center for the exposure to health policy. I've got to meet some incredible faculty and students, and during my time at Duke, we started a new health policy student organization called the Duke Student Collaborative on Health Policy, or SCOPE for short. We've launched new student-run house courses on transforming the US healthcare system and drug development. And I think the opportunities for student engagement with health policy at Duke is endless. So I would encourage any student interested in health policy to definitely engage with the Margolis Center. And I'm excited to continue to work in the health policy field throughout my career and hopefully play my part in building stronger and more equitable health systems.